Well, this is Dr. Saad, and as you know, we are recording series of lecture for pharmacists who are going to prepare for international equivalency exam. So this lecture is our last topic from the central nervous system, and after this we will resume our new system. So let's start our topic. In this topic, we will specifically discuss the Parkinson disease and dementia. Let's begin from the Parkinson disease. Parkinson disease is a specific disease of central nervous system, or you can say a nervous system in which a person who is affected by this disease, there will be a visible uncontrolled activity in his body. So let's talk about sign and symptom from where we will easily identify that which type of activity are visible in a person who is affected by the Parkinson disease. He will show specifically bradykinesia, that is the slowness of movement, specifically in this disease, and tremor at the rest and postural instability and reduce the blink frequency and facial expression like hypomanic situation will be visible, and postural hypotension and dementia with the advance of age with this disease, and similarly specifically there will be a disturbance in sleep pattern. So these signs and symptoms will happen out of control in a person who is affected by this disease. So let's talk about the share of group of drugs which play a key role in management of this disease. Number one is about we'll talk about the carbidopa levodopa. Carbidopa levodopa is a drug which plays a key role for the management of Parkinson disease. Similarly, second drug group of drug is dopamine agonist, which can be play a very key role for the management of Parkinson disease. And third number is about the apomorphine. Apomorphine is has an advantage in the management of Parkinson disease, but nausea and vomiting is an effect which is associated with this drug. So once you are going to implicate this drug, then you must need to start domperidone 20 mg TDS 2 to 3 days before while starting this therapy, because we cannot use metoclopramide and chlorpromazine for its management, because these two drugs block dopaminergic receptors, which will further make this Parkinson disease worse. So at fourth number, we can also include COMT inhibitor like catecholomethine transferase inhibitor. Its example is the tolcapone, and its dose is 100 to 200 mg TDS. But hepatotoxicity is a problem which is associated with this disease. So be careful while using this drug. Similarly, we can also use the monoamine oxidase inhibitor, specifically non-selective, or we can use selagelin, whose dose shouldn't be exceed with the 100 mg, but this drug should be used in combination with the entacapone. So this is a drug which is specifically used with a combination with a combination of carbidopa and levodopa also. So this was all about the monoamine oxidase inhibitor, which has an also share in the management of Parkinson disease. Similarly, we can also use amantadine with the dose of 100 to 400 mg per day, and anti-muscarinic medicine should be used, but with the close monitoring is required because of their side effect profile. So these are the drugs which can be a part of the prescription whenever you will going to deal with a person who is suffering from Parkinson disease. These drugs must gain a specific share in the prescription. So just for a review, I'll repeat once again that carbidopa, levodopa, dopamine agonist, and apomorphine, and COMT, catecholomethine transferase inhibitor, and non-selective monoamine oxidase inhibitor, entacapone, amantadine, and anti-muscarinic drugs. These are the drugs through which we can manage this Parkinson disease. So this was a brief review of Parkinson disease, and specifically I give you a reference of all drugs relevant to nervous system which plays a key role for its management. So let's jump to our next topic, that is the dementia. Dementia, as name indicates, sorry, dementia, as name indicates that dementia is a loss of memory. So let's talk about its specific factor before going into the detail of prescription management of pharmacological management of dementia. First of all, we talk about the risk factor, and first risk factor is the age. With the advance of age, dementia specifically progress. So age is one of the important risk factor. Second is the lifestyle risk factor, which we can easily control when we can easily advise to the our for ourselves and for our patients. Lifestyle advice is that first of all, smoking is a risk factor. Similarly, sedentary lifestyle is a risk factor. So you must advise your patient to avoid smoking and have an active lifestyle. Similarly, excessive alcohol consumption. So there must be once a patient is alcohol consumer, it is one of the important risk factor for the men in the dementia. Similarly, diet like high saturated fat, sugar, salt, and obesity in the middle age. These are all among the risk factor which come under the lifestyle advice. So this must be changed. Secondly, a third number risk factor is about the comorbidities like Parkinson disease. If a person is affected by Parkinson disease, as we talk about the sign and symptom of Parkinson disease, that once a person is affected with the Parkinson disease, with the advance of age, it will shift into the dementia situation. So Parkinson disease, stroke, and type 2 diabetes mellitus, and high blood pressure. These are comorbidities which acts as a risk factor for in the dementia. Similarly, at fourth number, there is genetic factors. For example, Down syndrome and you can say you can say frontal and temporal lobe damage of the brain part and Huntington's disease. These are the risk factor for in the dementia. No, so next point which we will discuss after risk factor is about the protective factor. How we can change our lifestyle before going toward the pharmacological approach to avoid from falling in this to or you can say to fall in the range of this disease. There are some protective factors. So number one is about the high level education. If you are mentally alert and active and learner, then this will keep you away from the dementing situation. Second is the more mentally demanding occupation. For example, if you're doing research or doing mathematics or solving problem or learning language, or you can say anything in which your mind is being used, then there is a very limited chances of getting or falling into the dementing situation. Number third protective factor is about the cognitive stimulation. Like you keep on doing puzzles, solving puzzles, or learning second language, or keep your mind in a situation in which your mind will face a specific challenge. In this way, you will receive a cognitive stimulation and this practice would keep your mind away from the dementing situation. Similarly, at fourth number, there is a social engagement. For example, socially active person this will improve mood and reduces the risk of depression and reduce the loneliness. This situation, like if you stay away from the loneliness and you can say you improve your mood, and similarly socially active and reduce the or you stay away from the any sector of depression, then there will be these are all situation comes or you can say defined under the social engagements. If you have a social engagement, then you will stay away from there will be minimum chances of getting fall into the dementia. Similarly, the cognitive stimulation and more mentally demanding occupation and high level of education, these are all the protective factor which will keep you away from the dementia situation even with the advance of age. Similarly, let's move on our next point, that is the example of dementive situation, example of ailment which is defined as a dementia. So the most common form of dementia is defined as the Alzheimer disease. Alzheimer disease is a disease in which memory gradually losses. And let's talk about its sign and symptom. First of all, sign and symptom is to day-to-day activity management. A person who is suffering from Alzheimer disease, as you can say, dementia situation, he can't manage his day-to-day as usual as a normal person can. Similarly, concentration, planning, and organization. A person can't plan, concentrate, or organize anything once he is suffering from this disease. Similarly, judgment. A person who is suffering from Alzheimer disease or any other sort of dementia, he can't do a judgment. And similarly, language. Once a person is suffering from this Alzheimer disease, then he will speak, and while speaking, he will make a clear mistake, which is very, you can say, easily identifiable. Once a person, and this will indicate this person's falling into this dementia situation. Similarly, visual. You can say, similarly, a person he can't analyze the situation, like he can't judge the distances. So this is also another very important sign and symptom of dementia. Similarly, orientation. A person will forget its routes or paths, from where it begins and from where it ends and how he had to go back. This is also a sign. Similarly, change in mood. This person will show a change in mood specifically. Similarly, visual hallucination. This person who is suffering from dementia, he will visualize something which actually doesn't exist. So this is also defined under the dementia situation. and delusions. These are all the sign and symptom which a person who is affected by Alzheimer disease or dementia, you can easily observe in in his personality, in his or her personality. So the main topic which we discuss this is that our pharmacological approach. So we'll talk about how once a person is defined as dementia, how we would manage it. The most important drug of class of drug which play a very key role for management of dementia is the acetylcholinesterase inhibitor. And under this class, we will first of all use donazepam with the dose starting dose with the 5 mg, and dose can be increased up to 10 mg once daily for 4 weeks. This will play a very important role for the management of dementia. Similarly, we can also use the rivastigmine from the acetylcholinesterase inhibitor class. An initial dose can be start from 1.5 mg 2 times per day, and dose can be increased to 3 times per mg, 3 mg per 2 times 3 mg per day for BD. You can say 3 times 3 mg BD dose. And if the 1.5 mg dose is well tolerated, just must keep in mind that if 1.5 mg BD dose is well tolerated, then we can shift this dose and increase this dose from 1.5 to 3 mg BD. And gelantamine is an also example of acetylcholinesterase inhibitor. It is also important part of prescription for the management of Alzheimer disease. And its starting dose is 4 mg daily for 4 weeks, and it can increase up to 8 mg for 4 weeks. And its maintenance dose is 12 mg twice a day. So these are the drugs which belongs to the class of acetylcholinesterase inhibitor. It play a very important role for the management, or you can say have a major share in the management of Alzheimer patient. Similarly, there is another next class is that will play a very role. That is the NMDA receptor agonist. Its example is the memantine. Its starting dose is 5 mg OD, and 5 mg OD to per week. There is a specific range like 5 mg per week to 20 mg per day. This is between this range from 5 mg per week to 20 mg per day. Between this range, its dose varies, but we will adjust it according to the patient response. So these are the drugs which play a very important role for the management of Alzheimer disease. Similarly, a side-by-side drug, we can also use the treatment strategies for the behavioral and psychological symptom of dementia. So this was all about our Parkinson disease and dementia, specifically Alzheimer disease. And as we have already discussed about the epilepsy and insomnia and depression and genetics like this one. So these are some mental ailments, central nervous system, or you can say nervous system associated diseases. As once we finish our autonomic nervous system, at the end we discuss that how we are implicating this autonomic nervous system drugs practically in our pharmacological plan, in the form of pharmaceutical preparations, as well as a part of prescription for the manage of various specifically ailments. Similarly, in the same pattern, we also concluded, first of all, we discuss all abstract points from all the chapters of central nervous system associated drugs with respect to its pharmacology and pharmacological angle. And then we, in the last in our last two videos, we concluded all these drugs which holds the share for the in a group or in combination in a synergism for the management of various conditions specifically associated with central nervous system. So this was our pattern of discussion and recording. So this is our first experience. That's why I'm sure we are making a lot of mistakes, but gradually we will improve with the help of your comments and with the help of your appreciation. So next topic will be we will start next topic, that will be the endocrinology and endocrine system. And in this way, first of all, we will discuss about the physiology and pathophysiology, and then we will talk about its a drug associated with this system, and how we are modulating their drugs for the management of various ailments. So thank you so much for listening my videos, and please subscribe my channel, and because your subscription is very appreciating for me. And also share my videos with your friends. If I hope first of all, I would also want to tell you that I have organized all my video in according to their system. So just once you go at my channel, you just go and click at the playlist. There you will find an organized videos, like those videos who are linked with the autonomic nervous system. They are in a separate folder, and those videos who are linked with the central nervous system, they are in a separate folder. So in this way, you can easily find an organized group of videos at a specific location, and you can specifically extract your required data. Thank you so much. Stay tuned and please subscribe me.